I'm Kathy Heberly with Power Force Coaching Group.
And I'm Steve Nowotniak. I'm a licensed occupational therapist and I live with a bipolar condition.
Steve, you've mentioned that you take meds. Do people with bipolar condition ever take meds and they don't work for them, and what should they do?
Sure. And dealing with the meds and that internal regulation and the side effects and the experiences of being on medication, that's a pretty standard thing that people deal with. And this can be, this is any mental health situation. It could be depression, it could be anxiety, it doesn't have to be just bipolar. But the piece to keep in mind is that what it's doing is actually helping to regulate the chemical state within the brain. And the body has a reaction to it. And is that helping the body make the required adjustment? Now in the beginning, the thing about psychiatric medications and with this mood disorder, because it has to do with being in the bloodstream and having the body accept it and accommodate it and work with it, it's not a pop two of these and feel a difference in an hour. It really, it can take a couple of weeks to start feeling something, and then a month in order to actually be at its full level. So there's a whole process there. And with that, you're dealing with some of that side effects. You can deal with lethargy, you could deal with just exhaustion, you could deal with brain fog, you could deal with, sometimes you feel that detachment, like it's kind of like a zombie-like state people can feel like. So when all this stuff is going on, our bodies are trying to get accustomed to it. It's not always comfortable, it's not always fun. Some people find that, oh my gosh, this is exactly what I need, and it's clarity right out of the box. So who knows how our individual bodies are going to react with them. The important thing is it's over the long haul, and the important thing is really is it a tool that's helping me. So an important piece to look at is, we're talking about a process here, and we're really talking about a month. And so just because you're feeling a certain way, unless it's dangerous, unless all of a sudden you're feeling like suicide or depression or something's really been increased where it's threatening, then talk to your doc and get off it right away, definitely. But if you're feeling that discomfort, sometimes you kind of got to get through that and let your body get used to it. So I'll put an analogy. It's kind of like you start to work out right away. And those first couple of days after you're working out, your body's really sore all over the place, and you don't want to move, and it's just really uncomfortable. But then if you keep going, your body starts to get accustomed to it, and then you might still walk around with that soreness, but it's in the background, and then you find you're able to actually do things better. But you got to kind of get through those couple weeks. And I find that that's what it was like for me with my meds.
So you're saying if something isn't working for you, it's all right to tell your doctor about it and see if there's something else to try, or just give it some time. Is that the
Absolutely,
okay.
Absolutely. The important thing is that there's a lot of different kinds of things out there. So it's a matter of what works for you. It's also important to realize that medication is just a tool, and some people need it temporarily. Some people are able to do it without it. Some people find that they don't like it, but they're going to do it in other ways. The important balance is that we're in relationship. We're in relationship with ourselves. We're honoring what are we causing other people to have to deal with, and are we just dumping our stuff on them? It's also a relationship with the doctors, and are you able to have that kind of conversation where you're able to find the benefits and the side effects, and are the benefits or the side effects outweigh the benefits? And so that's the relationship to look at.
Thank you very much.
You're welcome.